So now I'd like to introduce our speakers, and I'm going to turn it over to them. And I'm actually going to go from right to left because that's the order you're going to hear from everyone. First, I'd like to introduce Dr. Angela Lindsay. She is an assistant professor in Family, Youth, and Community Sciences Department at the University of Florida. She's also a Pi Center affiliate faculty. Next, you'll hear from Dr. Lori Baker. She's an associate professor in the Department of Agricultural Education and Communication and a Pi Center affiliate faculty member. One thing to mention about our first two speakers, Dr. Lindsay and Dr. Baker, they're going to be focusing more on the Pi Center's public opinion data on COVID-19 vaccines and trust in science. Lastly, you'll hear from Dr. Ricky Telg. He is a professor in the Department of Agricultural Education and Communication. He's also the Pi Center director. And Dr. Ricky Telg is going to talk about the COVID-19 vaccine communication toolkit that was created in conjunction with the Pi Center, as well as the Southeastern Coastal Center for Ag Health and Safety. And he's going to talk about how to access that and how to use that most effectively. So at this time, once again, I want to thank all of our participants for being on with us today. I want to thank our three speakers, and I'm going to pass the microphone off to Dr. Angela Lindsay.
Great. Thank you so much, Philip. Well, welcome everyone. Good mid-morning to everybody. And I appreciate y'all being with us here today. I'm going to give us a little bit of background regarding the Pi Center, but also kind of give some background to how we got to where we are today with this fourth webinar on the research on COVID-19. So to give you a little bit of information regarding the Pi Center, if you're unfamiliar, the Pi Center is a center within the University of Florida IFAS, which is Institute of Food and Agricultural Science. We conduct and disseminate objective, interdisciplinary research and educational programs to increase public understanding of and engagement in complex agricultural and natural resources issues. These research and educational programs do and help enable the public to make informed decisions about Florida's agricultural and natural resources. We encourage informed decision-making through research, education, and outreach as well. So looking at why do we do this? So just to kind of give you a background of how we got to where we are today with the fourth webinar on this COVID research is we began our initial research back in March 2020, pretty soon after the shutdown, looking specifically at the public opinion on COVID-19, as well as the disease's impact on our agricultural and natural resource sectors as well. And as everyone can agree, this pandemic has broad implications on how everyone will be communicating about public health. And for us at the Pi Center, specifically looking in those areas of agricultural and natural resources. The Pi Center, we have a rich history of conducting research in this related to risk and crisis communication topics. So this was a natural fit for us to look at this and understand how this is going to change communication regarding complex issues and issues in public health that will be impacting the agricultural and natural resource sectors as well. So what have we done this far? How did we get to this point? And that's what this slide here talks about. You'll see this is the fourth webinar on the research on COVID-19. So, and as you can see through the slide, we've done 3 public opinion surveys already, one in March, one in April and May, and one in September. Well, actually, the survey 3 was done July 23rd through August 9th, 2020. Analysis was happening in September. We also conducted research with our ag and natural resource sectors. That's the one that happened middle of March to about the middle of April as well. In our past webinars, our information sheets and graphics and informational videos on all of these particular past research that we have done can be found at that link there that you see, the picenter.com/COVID-19. Okay, so moving ahead to the timeline. And of course, I'm not going to go through the timeline from when lockdown happened in, of course, March 2020, but let's look specifically at maybe what was going on before the survey came out, but also what happened while the survey was out. And on this chart, you'll see some of the major developments as we were developing the survey and during that data collection. We launched the survey on January 8th. On January 11th, the CDC reports 25 million doses of both vaccines, that's the Moderna and the Pfizer, have been distributed and 9 million were administered. On January 12th, the Trump administration asked states to speed up vaccine delivery to 65 and older. On January 13th, the US surpassed 23 million cases. On January 15th, Biden announces the vaccine plan to administer 100 million doses in the first 100 days. On January 18th, US surpassed 24 million cases. On January 21st, Biden signs the 10 executive orders related to COVID-19 response and vaccine distribution. And also on that January 21st, the Pi Center survey closed and the US rejoined the WHO. So I also wanted to make sure that in addition to these dates that happen in January, we also look at some of the slides or look at some of the events that happened right before those January dates. So next slide, please, Laurie. Thank you. And so these are just some other relevant events that happened right before 2021 or right after the turn of the new year there. So December 11th, 2020, the FDA issues an emergency authorization order, emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine. Not too much later, about a week later, the FDA issues a EUA, for the use of the Moderna COVID vaccine. January 5th, 52 cases of the UK variant of the COVID virus are confirmed in the US by the CDC. January 29th, the state of Florida announces pre-registration system for COVID-19 vaccination among priority populations. And then, of course, late January 2021, we started hearing more about the 2 additional variants that were out there as well. So started hearing more and more about some of those variants and what was going on at that particular time as well. So that is kind of giving everyone the background of how we got to today. So before I turn this over to Dr. Laurie Baker, please keep in mind some of these events and some of the things that happen within your own communities in regards to not only the variants, but the vaccine and vaccine distribution as well. And so, but those that have happened leading up to the data collection, but also things that have happened over the past year as well, because as we know, there's a lot going on. There's a lot that has been going on. There's still a lot that's going on. And those events that happened after data collection as well. So Laurie, I'll turn it over to you now. Thank you.
Thank you, Angie. Yes, I am going to focus on the data we collected during that last timeline that Angie went over just now. And I'll start a little bit with our methods. We conducted an online survey questionnaire developed by our staff and myself here at the Center for Public Issues Education. We also worked with people at UF1 Health and other colleagues who have more of a background in vaccines and health issues to make sure that everything we were saying was appropriate and made sense. Angie pointed out our data collection there was the 8th through the 21st of January 2021, and we had 1,549 participants nationwide, and we sampled for characteristics to match the US Census. So that's about as representative as we can get in this type of survey format. So with that, I'm going to dig into what we all really care about and talk about some of the findings and implications from this particular survey focused on vaccines and trust in science. So I'm going to go back a little bit in time. When we did that very first public opinion survey, we did ask people at that time, if a vaccination were available for COVID-19, would you get it? And again, those dates were March 13th through the 16th, and this was an American US representative population, and 80.3% at that point in time said, yes, I would get the vaccine. Well, a lot has happened since then, almost an entire year from when we collected new data, and vaccines were actually available when we collected this new data. And as you would suspect, news coverage and other things affected people's decision on whether they would or wouldn't get that vaccine. So here on the right, you can see from our most recent survey, how many people were willing to get that vaccine. And the total that were willing to get it was 69%. So it did drop from that 80% when we were talking about this hypothetically when a vaccine didn't actually exist. So that overall percentage did drop a little bit. Just for some context, we also asked people if they regularly got the flu vaccine, and 61.1% said that they did regularly get the flu vaccine. So that tracks pretty similarly with those who said that they would be willing to get the COVID vaccine. A few more said they were willing, and 12.8% of people surveyed had already received the vaccine. when we launched our survey, and 46.9% of them knew someone who had received the vaccine. So those are all just a little bit of context before I get in to some of the specifics about what they thought about the vaccine. So very first here, we ask a series of questions on a bipolar scale of what do people think of the vaccine in particular. And so you'll notice that in general, these were fairly positive. The majority of the people had positive perceptions about the vaccine. So those that are in green were ones that were on the line of useful in this top one. And those that were in the blue were on the negative side. So the very top one thought it was useless there with the lower percentage. And the white section in the middle were our neutral people who didn't have an opinion one way or the other. So these did all track toward the positive. The highest percentage there was for useful at 69.9%, good 67.5%, wise 67%, beneficial 65.9%, desirable 65% thought that it was, and 61.6% thought that it was safe. So for those of you who are working with members of the public, to understand what they think about the vaccine, what they feel about the vaccine, the overall perceptions have been positive in this data related to the vaccine. We never want to ignore the people over here in the blue, of course, that had negative perceptions about the vaccine, because those are not totally unrelatable numbers. It wasn't 100% of the people who said that they had positive thoughts about the vaccine. So as we're engaging with members of the public, kind of want to keep that in mind, that some of them did have very strong negative reactions to the vaccine. So another series of questions that we ask were around what would prevent them from getting the vaccine. And we based some of these questions on a theory or a concept called community-based social marketing. And the idea is that we really want to study the population and understand what their current behaviors are and what any barriers might be for them to get the vaccine in this case. So as we looked at these, the biggest reason for people not wanting to get the vaccine were potential risks associated with the vaccine. You'll see 56.7% had that concern. So that was a majority of the people surveyed. Associated costs, another 43.4%. Insurance coverage concerns, 42.3% there, and a lack of ability to go to the doctor were 32.9%, and a lack of time at 28.3%. So these do gradually go down, where the majority of the population was not saying that they lacked the time to receive the vaccine. But overall, people did have these concerns. So as we're working with our communities, we can think about how can I help them minimize some of these factors? How can I talk about potential risks? How can I talk about associated costs? Are there opportunities to cover those costs through federal, through state programs, through other types of programs? Those of you that work with people in insurance or in healthcare professions, working with insurance companies and doctors to let people know what will or won't be covered. And a lack of time, I think we can certainly all relate to that being a factor for many people. So as we're thinking about how we might be able to eliminate that barrier, the more convenient that we can make it at places of work, at places like schools where people would already be going, we might be able to alleviate some of these barriers for our stakeholders. So continuing with that, we also wanted to know what motivated people or would motivate people to receive the vaccine. And some of this has to do with identifying how they feel about others within their network. So we talk a lot about what the social norms are. And even just this morning, I've been receiving friends from my text of, oh, maybe it looks like we might be able to get it. Or, what are you thinking about doing? And so we are all kind of making these decisions as a community. But the number one thing that came up as motivation for people was wanting to do what healthcare professionals think that they should do. So there's a huge role clearly for healthcare professionals and those who work in public health to help people make these decisions. These, you'll notice, the green were the positive, the blue were the negative here that disagreed. It's on a 7-point scale, and those white lines in the middle are the mean, or where the majority of the people fell in this. So the larger percentage of people and the higher mean there is for healthcare professionals, but they also want to do what health organizations think that they should do and what members of their family think that they should do. And these gradually go down. So doing what their friends think they should do is a little bit lower. And I want to do what my colleagues think I should do is a little bit lower, but still leaning toward the strongly agree side. Again, I certainly caution that we don't want to ignore the people who disagreed with these statements. And it will be important for us to find out what their motivators are and who are the opinion leaders within your community that could really make a difference in people's willingness to get the vaccine. One of the other things that is important within the framework of community-based social marketing is really understanding what those influences are and identifying any types of incentives for people to do that in-state behavior, in this case, get the COVID-19 vaccine. So we asked people what influences their decision to get the COVID vaccine. Medical risks were high in that. So people that already had pre-existing conditions of some kind, who felt like they were going to be excessively disadvantaged. The majority of the people fell into that category. And concerns about unknown long-term risks were certainly a factor. So again, as we're having these conversations, helping people understand in general about vaccine risk, knowing that we don't have quite as much data on risk yet about the COVID-19 vaccine. And my level of trust in pharmaceutical companies was also in that top 3 influencers. Other ones that came up fairly high for motivations and incentives, recommendations from the CDC were the next highest, followed by reactions and testimonials of others who have received the vaccine, a gift card from a store or a pharmacy if I took the vaccine, and recommendation from the president. These all were more positive than they were negative, but we have them in ranked order. So the top 3 were the major motivators there for people. But these should not be discounted. Again, for some populations, these were important aspects of that decision-making process. All right, so what role does trust in science have in this piece? And we've talked about this in some of our past webinars, and it's certainly something that we've continued to explore through the PI Center in general, is how people trust science. And this is a time where science is evolving in front of people, and they're seeing scientists test hypotheses to see what does work and what doesn't work. And there's been some fear around those pieces. So we really wanted to embed some information in this survey about how people felt about trust in science during this time. And so we took an already established scale related to trust in science and asked people a series of questions. There are many more questions in this data set, but we pulled out some of the highlights for you here today. So the 3 highest levels of trust for people were related to these 3 here. I trust that scientists are being honest in their work, 66.9%. either agreed or strongly agreed there. And I trust that scientists are being ethical in their work, 65.3%. And I trust the work of scientists. So again, a majority here, 64.2%. So they agreed or strongly agreed. Again, with all of these, I caution that there were people that were either neutral or disagreed with these statements. So it's not that the entire population trusted scientists for being honest and ethical and trusting their work, but overall the majority did have positive views of trust in science in these categories. As we break that down a little bit differently, this was asked on a Likert scale, with 1 being strongly disagree and 5 being strongly agree. So you'll notice those in blue were our disagrees, and those in the green were the strong degrees, with the means in the middle. So those top 3 are the ones I covered in the previous slide, but the next highest means there were, I trust that scientists are being ethical in their work. 3.74 was the mean there. I trust scientists to share their discoveries, even if they do not like their findings. So that was, more positive than negative. Here on the right side, I pulled out a few of these that I think have particular relevance related to COVID-19 and the vaccination, as we've kind of seen science evolving in real time. So another relatively high mean, or that was at least a positive mean, was we can trust science to find answers that explain the natural world, which we're watching them do over this last year here. And this next one, when scientists change their mind about a scientific idea, it diminishes my trust in their work. And I pulled that one out because I think it's particularly relevant for us to consider right now, where scientists need to change their mind because they try one thing and it doesn't work to combat. And so they need to try something else to combat COVID-19. And we will continue to see this evolve in real time. So that mean wasn't overwhelmingly positive, and in fact skewed toward the negative, but that was still quite a few people who were concerned about scientists changing their mind and that affecting their trust in science. So those that are working with the general public, those that are working with all of our stakeholders, this is again an opportunity to really communicate about how science works, and that trial and error is a process and it's a part of the scientific process. So continuing to have those conversations about what science looks like and why scientists need to change their mind, and that that's actually positive, that they aren't sticking with an idea just because it doesn't work. The next one that I pulled out there was we cannot trust science because it moves too slowly. And that mean was much lower and skewed toward the negative there at 2.49. But all of these had pretty high standard deviations, meaning there's a lot of variation in people's personal beliefs related to this. But I think as we're seeing things happen in real time, again, science moving slowly is a thing that happens, and that should happen because we want to make sure we get it right. So explaining that process is important. And that last one there of scientists do not care if laypersons understand their work. So that's certainly concerning for those of us who work with members of the public and communicate science to the public. And again, it did skew negative, it was lower, but there were a considerable amount of people that felt like scientists did not care if laypersons understood their work or not, which those of us working in science communication want to alleviate that concern for people, that scientists do care, and we are actively making an effort to make science understandable as a part of our extension mission. And Ricky Taug will have more about how we can do that in the toolkit a little bit later. So those were some of the highlights from this most recent data collection. But as Angie mentioned in the beginning, we have been doing this for quite a while now. Literally a year of our lives has been dedicated to studying public opinion on COVID-19. So here I have some of the major things we've collected over time related to knowledge and personal responsibility and concerns of all different areas. What we presented today was focused on that vaccine trust and trust in science. But we have a lot of other pieces of this, and you can go to the piecenter.com/COVID-19. We have issue guides and graphics to download, as well as the webinar will be posted later for all of our surveys. Right now, as of this morning, hot off the presses, the fact sheet about the COVID-19 vaccine data collection, this most recent one, is available, and all of the graphics that I used in the presentation today are available there to download and share on social media. And coming soon, we will also have a video, as we do with all of these, on this particular section. So with that, I am going to turn it over to Dr. Ricky Telg to talk about the Vaccine Communication Toolkit.
Great. Thank you so much, Laurie. Before you mute your microphone, I've had several questions in the Q&A come up about one particular question, and I thought it would probably be easier to address that now. And then, of course, if you have other questions about Laurie's presentation or information that Angie's provided, or about the toolkit that I'm going to talk about, we'll answer those at the end. But the question that people have asked is about the president question. Again, I've received a couple of these, actually 3 questions related to that. Did we specify which president in that question, or just the president in general? Because if you remember, our survey was done right as the administrations were changing at the time. We actually debated whether do we want to do it earlier or later, but we wanted to also get really right on there as more of these vaccines were receiving these emergency authorizations. So if you could maybe talk about that particular question.
Sure, that is an excellent point. And we did not specify which president, we just specified the President of the United States, which is a data point that we've included throughout the surveys. So we did not necessarily specify which president. So that certainly could have affected people's perception, whether they were thinking about the president who was in the process of exiting the office versus the president who was incoming into the office. So we did not specify which president.
Great. Thank you. I just wanted to clarify that, because that's been one of the questions that's coming out in the Q&A. But right now, I wanted to bring up and talk about the Vaccine Communication Toolkit. Everything that has gone on in our research in the PI Center has actually influenced how we want to communicate best practices, best messages about vaccines. And so this communication toolkit was developed by the PI Center, next slide, in collaboration with the Southeastern Coastal Center for Agricultural Health and Safety to support rural communities, agricultural communities, workers in agriculture, fisheries and forestry, and extension professionals to communicate about topics related to the COVID-19 vaccine. Resources included in this toolkit were developed by experts in issues and crisis communication in collaboration with experts in public health and epidemiology. And this is information that is adapted from the CDC and from our own UF Health organization here. The toolkit, as we'll go over the next few minutes, this is kind of all the bullet points here about what the toolkit includes. And we'll look at each one of these specifically. Includes information sheets of FAQs, or frequently asked questions and answers, social media graphics, a guest news column if you want to include this as an op-ed piece for your organizations or along those lines, message timeline, best practices for communicating, as well as expert contacts and links to other sources relevant to the Southeast region, which is what the Southeastern Coastal Center oversees. I just put in the chat the actual link to the COVID-19 vaccine webpage. So if you would like to go there now, you're welcome to do so and kind of follow along. That would be great. Otherwise, that will stay in the chat throughout the presentation this morning, so that you can use that at your convenience. The first thing we want to look at is the information sheets of FAQs. And so there's, as we all know, a lot of information there that's out in terms of both media, social media, about the vaccine. So what we tried to do was to create several individual pieces that could be adapted and used for your purposes to communicate about vaccinations. And so one of those fact sheets is about just general questions about vaccines themselves. And then the other three are much more specific. One dealing with those who have allergies, one that deals with those who are pregnant or nursing, and those who have immunocompromised systems. And each one of these sheets is also in a customizable option form. So you have two options here. One is, as you see on the graphic there on the right-hand side of your screen, this is the version that doesn't have the customizable option. It has the Southeastern Coastal Center for Ag Health and Safety's logo on the bottom left-hand side. So that is definitely available to you. But if you would like to customize these sheets, next slide, Lori. There's also a customizable option too. As you can see on these three examples, the bottom right-hand side of each of those is a PDF that allows you to insert your logo for your extension service in your state or your agricultural organization as a way to customize each one of these information sheets to provide to your sources and your clients in your particular area. So we try to do this so that everyone has the opportunity and availability to provide this information in a customizable format. In addition to the information sheets, as you saw, we also have social media graphics that are created for these areas for Facebook, for Instagram stories, and for Twitter. Each one of these has a standalone format as well as a customizable option like you saw with the FAQ pages. So again, you would have the availability to put in your logo at the bottom of these Facebook, Instagram, and Twitter posts and graphics so that you can put that on your own post with your own logos there as well. The next piece in the toolkit is a guest news column. And so again, this is customizable to your state, to your organization, because as we know, there's a lot of misinformation out there about vaccines. So this could be used in a blog post for your county, for extension, for example, or as an opinion editorial piece, if you have a column in a newspaper or an organizational newsletter. This provides, as we say, just the facts about vaccines, as well as a place that you could put information about to contact you or to contact an expert in your particular state as well. The next piece is related to a message schedule. And so we want to provide you with information about when to share this information. So on page 10 of the toolkit, there is a schedule of messages to share now, messages to share once the vaccine is available to all, and messages that will remain relevant. So for example, in the messages to share now, this would be when the vaccine is currently available to some groups, but not to everyone. And so in this case, we want these messages to focus on answering questions that support decision-making related to the vaccine. Many of the messages available in this toolkit are ones that you can share with your audience now. And so even the guest news column is an item that you can use to communicate about the vaccine to your stakeholders right at this very second. For the information related to messages sharing about once the vaccine is available to all, the messages should really focus more on accessibility to the vaccine, including where and how to get the vaccine. And then messages about what to do once you receive the vaccine would be appropriate at this time. And then lastly, messages that will remain relevant. Much of what Lori has already shared about information and about vaccines. And these are messages that will remain relevant into the future, including those that focus on the importance of vaccinations and recommendations from health organizations about revaccination. Organizations should continue to share information about common questions related to vaccines. The next piece in the toolkit is a page related to best practices. Again, wanting to share information is great, but it's also a good idea to practice these in regard to providing information to individuals. So we just have this list of what we call these best practices. One is about avoid spreading misinformation. We recommend strongly that you only share information you know to be true and that comes from a reputable source. Secondly, to listen to the concerns that people have related to the vaccine and share answers when they are available. Thirdly, not to answer anything that you are unsure about. And this is really important for a lot of us who are on this call. I mean, I'm a communications expert, but I'm not a health expert. I know how to communicate messages, but there may be information that's out there that is more of a health related type of response. We have some experts that I'll bring out in just a second as far as the contact information. If there's an individual or question that you have that you're not comfortable answering because you're unsure about, connect your clients with these experts to find the most accurate answer available. Next is to share your story related to the vaccine if you're comfortable doing so. So if you receive the vaccine and you feel comfortable about doing so, tell your clients and your friends. But next slide, if you do so, choose to share your story related to the vaccine, be sure not to post your vaccine verification card. We're seeing a lot of this on social media right now. This contains private information. So share this graphic that you see on the right-hand side. We actually have these available as part of the toolkit that tells your network that you have been vaccinated. So something that's very generic, but it does show that, hey, I got my vaccination today. Also, if you choose to share your story related to the vaccine, understand that you could receive some negative feedback. Sharing your story face-to-face can maybe limit that negative feedback, but if you choose to share your story on social media and receive negative feedback, respond with facts and don't engage in unproductive conversations. Maybe sending a private message to a person who has questions or maybe have provided that negative feedback would be a more effective approach than to begin the idea of sharing and responding to potentially negative comments. So again, communicating about the COVID-19 vaccines can be challenging, but always ensure that you're practicing these best communication principles when you do so. The next part of the toolkit is, again, the expert contacts. So what we try to do here is to identify experts in the states within the Southeastern Coastal Center for Ag Health and Safety region. These are both health communicators as well as people who specialize in crisis and risk and emergency communication. So this list is available to you, but if you would like an expert added to this list, we suggest that you contact the PI Center's communication specialist, Ashley McLeod-Morin. Her email address is there, and you'll see her email address at the very end of this presentation as well, because we want this to be a living document to continue to improve and enhance and to add more experts as those are identified. Next slide. Again, the toolkit, like I said, I've provided that in the chat section already, but this is the web page that goes there. I do want to mention that we are in the process of getting translations in Spanish and Haitian Creole. We should have those translations back. These are going to be certified translations because this is part of a federal grant with the Ag Safety Center. All of the translations have to be by a company that are certified in the languages. So we will be getting those translations back probably by the end of this week and hope to have the translations of all these materials in Spanish and Haitian Creole within the next week or two. And just so that you're familiar with the website there, this is a screen capture that you see there on the right-hand side of the page. That big graphic there that says COVID-19 Vaccine Communication Toolkit, That is actually a flip book that you can use if you haven't gone to the website already. If you click on it or the link right above it, it will actually load a PDF that you could print off as well. And then each of the yellow oranges rectangles below the Toolkit flip book are downloadable information. So some of them are actually individual files. Most of those are zip files that have all of the material. So the one on the bottom left-hand side, it says download info sheets. That includes all of the information FAQ pages that we mentioned earlier, both the regular sheets as well as those that are customizable. And so you can download each one of those as a zip file for your purposes to communicate about vaccine information there. On the next slide, again, is some more information. If there are other resources that would be valuable to your program that you wouldn't mind sharing with us that we could help to let people know about, especially the expert contacts, please let us know, specifically Ashley McLeod-Morin, who is, again, our PI Center Communication Media Coordinator. She's also the communication coordinator for the Ag Safety Center Outreach Core. And that is her email address is Ashley, ASHLEYN, McLeod, MCLEOD @UFL.edu. And we'd be happy to update the materials that we have in our toolkit to address as many of those needs as possible. And with that, go ahead to the next page. It's time for questions for us, any of the panelists. I will facilitate the questions that may have been provided to each of us. And so with that, feel free to comment in the question and answer, I think that's what we're doing today as opposed to the chat. But we'll be happy to answer your questions at this time. So one person's provided a statement here, a kind of information here. So I'm going to read this to everyone. It says, science changes constantly, and finding a way to explain that to the public would be a fantastic achievement. One example of an area of science that has changed is likely in the public eye is forensic science. Because of those advances in forensic science, we see innocent people charged with crimes they did not commit being freed, perhaps using this or other types of familiar science to explain the science to people. So I think that's a great observation. Laurie, if you want to maybe comment about the idea here about science communication as well.
Yeah, I think that's a great idea. And it's something that, again, is a mission of the PI Center. So as we continue to analyze this data and see where the trust in science aligns specifically with COVID-19, we intend to explore more ways to make that more applicable. Certainly the concept of connecting it to something people already understand is a great one. And you're right, we've seen a lot of that in the public eye and in the news lately related to forensic science. So anytime we can come up with those examples that are relatable and people have seen how it has evolved and changed over time, will be important to helping people understand how this is relevant to their lives. So thank you for that. Appreciate your comments there.
Okay. The question says, did you take into account different race or ethnicities regarding their trust in science or willingness to get the vaccine?
We have not had a chance to dig into this data as much as we would like yet, but we did ask questions related to race and ethnicity. So we will continue to run some comparisons between those and trust in science, as well as their willingness to get the vaccine. Some of our partners who helped us develop the survey had partners who work for vaccine companies who were also interested in that data. And so as we continue to analyze that, we will share it broadly, either through journal publications or fact sheets or that type of thing. So if you stay tuned to our webpage there and follow the PI Center and or join our listserv, we'll communicate that information as we have it available, but we just haven't run those comparisons yet.
Right, thank you. So there's a question about the possibility of providing this information in other languages. The answer to that is maybe. It is difficult to identify which languages we do think that as far as the Southeastern region goes, we've been in contact with many of our partners and colleagues around the Southeast. And it seems, especially for the agricultural workers who are in the fields right now, that the two primary languages of the ag workers are Spanish and Haitian Creole. And that's not to say that we could not expand this to other languages in the future, but right now we are really focusing on the three languages that we feel are probably more indicative. Again, not discounting the idea of expanding in the future, but right now that we're trying to hit hard, fast, and heavy are English, Spanish, and Haitian Creole. Another reason why is that most of the materials that have come out of UF Health and other similar organizations and entities in the last several months have really highlighted those three languages. But I would say never, but right now, those are the three that we're working on. Question was where many of the workers, they're looking at the Vietnamese as another language. So again, that would be another possibility for the future, but we would need to look at that as well. There's a question here that says, where are the previous survey results, recordings, and reports located? Again, if you go to the actual PICenter.com/COVID-19 link that you see there right now on the screen, as well as Angie, if you can copy that and paste that again in the chat to all the attendees. That's where all of the past COVID-19 studies that we have done, as well as the other materials are. The toolkit is at the sccahs.org COVID-19 vaccine site that you see there at the very bottom. Question, it says, how will we negotiate and then quotation marks, a normal life as some people are vaccinated and others refuse to? That's a great question. And I'm not sure that we can or have addressed that in our particular research. I know right now with some of the recommendations or guidelines the CDC has just released within the last day or so about those who've been vaccinated and those who may not have, about whether to wear masks or whether to congregate with those who have not been vaccinated. It's going to be the word negotiate. It's going to be a negotiation about what normal is going to be like over the next several weeks, if not months, until there is a number of people vaccinated as well. Question is, do you have the questionnaire publicly available, or are you open to share it with other researchers? So that question's come up a couple of times in the Q&A.
We don't have it published just yet. That's on our task list, is to publish it in a place that's very shareable for others to use it, particularly for other extension programs. I do see one of the questions is if we're open to share it with other researchers. You're welcome to contact me. We have shared portions of the instrument with other researchers who want to collect similar data within particular populations or within different times. So we're certainly open to collaboration and interested in doing that. If you want to contact me directly, I can put my email in the chat. My information is, of course, also available off of the PICenter website.
Great. I think that's most of the questions that we've had already. If you have a question, please feel free to do so. Write that in the Q&A. But I'm going to ask Laurie a question, is that what of the responses that you've received from the survey this last time around maybe was most interesting to you based on the vaccine information that we shared with everyone today?
I think one of the things that's the most interesting were related to the motivations. I think what we see in a lot of cases is that family and friends are some of the biggest drivers for decision making and motivations for the actions we take in our lives. And in this case, personal healthcare providers were the #1, and that was followed by other health organizations. So I think that's kind of surprising from what we've seen in other cases. This, of course, is a very public health issue, so it makes sense from some aspects, but I think that's also encouraging from the standpoint that extension professionals and health communicators are positioned very well right now to be credible sources, to share credible information, and to make a difference in reaching herd immunity with the COVID-19 vaccine.
Great, great. We don't have any other questions in the Q&A. I do want to again reiterate what Lori and Angie have shared before about this important topic about science, communicating about science, of course, and about vaccine and information there. Please do go to the bottom web link that you see there if you would like to access the toolkit and any of the information there. And if you do have some suggestions for other contacts, expert contacts that we can add to the toolkit, again, this is a living document. We want to add more information and keep it relevant and updated as best as we possibly can. With that, Philip, I think that we are wrapping up today. I don't see any other questions here. Again, I want to just thank you all for joining us today, and I'm going to turn it back over to Philip to kind of wrap us up for today's webinar.
Sure thing. Well, I want to also extend my appreciation and thank you to Dr. Telg, Dr. Lindsay, and Dr. Baker for a great presentation. And of course, all of those that have been involved in the work getting these resources together. So I will reiterate it once again. Those websites for more information are in the chat. So go to the chat and you can click those. We are going to be posting the recording of this webinar as well. And if you registered for the webinar, you will receive a direct link for that as well. Lastly, as you're exiting today, be sure to fill out the survey that should automatically load in your internet browser when you leave the webinar. It should take no more than about 3 to 5 minutes to complete, and we appreciate your time in doing so. So if there are no other questions or comments, I want to thank everyone for joining, all of our participants, and have a great rest of your day. Thanks.